questions from the committee, and it looks like we have one. We'll do this for about 20 minutes. So, Michael, over to you.
I'm Michael Wald, committee member. Ariel, could you go back to your first slide? I want to look at your first and third slides.
If I can, yeah. That's not the titles.
Not your.
Yeah.
Okay. So there are two different halves of this slide. And what is clear from looking at the slide is the gap on the literacy, mathematics, language thing between the bottom quintile and the top quintile is very, very large. The gap on the behavioral side is much smaller.
Right.
And so I wonder what you do in thinking about why the gap is different in the behavioral side from the other side. And what you get also is, as you look at it, for low quintile, very low income parents, on the academic side, a consistent bad situation in terms of some academic outcomes. Much more variation on the behavioral side. And I wonder in terms of that about whether there are subgroups on the behavioral side that account for the 44% for the difference, and whether one has to think on the behavioral side differently in terms of subgroups. And could you jump to your third slide also?
Yeah. It's a very long question, Michael.
Very long question. Well, but it's all on the same thing. It's about how much we're focusing on cognitive reading versus how much we're focusing on other outcomes like mental health, behavioral, and social competence, and whether the same sets of interventions that you're thinking about that are behavior-based can work in the other realm and is with a different population. There is this huge gap that you show in college thing. If we actually looked at high school graduation, that gap doesn't look nearly as big over time. If we looked at delinquency, actually the gap has shrunk enormously. If we looked at births to teens, the gap has shrunk enormously. So what is it about the cognitive side, and how much is it that these things are working on the cognitive side, but something else is something we should be thinking about on the other sets of behaviors and outcomes for children?
Great, got it. Let me think about this. So, I mean, obviously there's more variation in the cognitive skills here. I mean, the range is a lot bigger here. And frankly, I don't know if this is a measurement issue. I mean, these are 4-year-olds. I'm not an expert in measurement on either one of these dimensions of kids' outcomes. So I would, suggest to the committee thinking about that, whether that is a piece of it, whether we are just, better able to measure the cognitive skills and better able to demonstrate gaps across whatever dimension we're interested in. As far as, I think, the other question you want to ask, of course, is what's the correlation between these early skills and later life outcomes? And I think if we can see different, to understand whether they're qualitatively distinct phenomena or whether they're, part of a broader package. I mean, they're, Greg has obviously done a lot of work in this area, and I know where he stands about the relative importance of, cognitive versus non-cognitive skills in early childhood and later life development. So I guess I'd want to think more about the relationship, between these early childhood mental health problems and later life outcomes before I kind of wrote them off as not showing a whole lot of variation by family background. They're still present, even though, as you say, they're smaller. Subgroups, yes. Although I also think we have to think about these kind of, in my opinion, it's a challenge to think about designing interventions for particular subgroups versus really trying hard to think about what are the things we wish all parents would do, and that in particular, parents from economically disadvantaged backgrounds are not doing. And I think that there's enough work to be done on, there's a lot of work to be done on that question. We can be thinking about subgroups at the same time. I'm personally worried that we don't know enough about the first question to go to the second question, which is how do we tailor these different kinds of programs for different subgroups? That's what I think about that question. I think that were those the big ticket items?
The last one was whether we're sending home with an iPad.
Oh. Oh, yeah.
Executive functioning, behavioral content.
In kids or parents?
Can I just have you repeat his question since he's not at the mic?
Sure. So the last question was, do these nudges and text messages and other, light, low-cost, light-touch approaches work for parents or, promoting kids' executive function or promoting parents' executive function? I can let you know in about a year. I mean, we're doing an intervention right now that will try to do the very same things to do a technology-based mindfulness or stress reduction program for parents. And the goal of that kind of program would be to see if it results in improved parent-child interaction and ultimately improved child well-being. I think we don't have any idea. There are, less than 10 studies at the present time that have tried to do these kind of behavioral approach to parent behavior change. It's well worth trying.
All right, let's go to Oscar.
Hi, I'm Oscar Barberin from Tulane University. I'm a member of the committee. I have a question of clarification. The other is to see if you would modify some of your statements a little bit. First of all, thank you. I was very impressed with how much you were able to present in a short period of time. The question for modification, I'll start, is there are a number of assertions that you made. Information alone does not change behavior. Who do parents listen to, not to experts? And I guess I would like to get you to say it depends, because it seems to me that it does depend upon whether the information is expert-based and who the parents are. So, for example, information about immunizations, think about medical things, sleeping, nutrition, or issues I think that can influence parent behavior. It also depends on how easy it is to implement, how discrete the information as opposed to how extensively it involves. More complicated questions about discipline that involves values and judgments, which are less expert-based, it seems to me, would fall into the domain of information is not alone. But that there are lots of, so I guess what I would like to do is sort of make the argument that information is valuable. As a purveyor and developer of information, it seems to me that it is valuable and can change people's behavior. And then the second thing has to do with, I think, a very interesting, provocative startup that you'd like to emphasize behavior, sort of focus on the distinction between behavior change versus development. And I was wondering if you could, your interest is that you'd like to think about parenting less as behavior change, I thought, and more as development. If you could elaborate, I wasn't quite sure that I understood what you meant by that.
Okay, so let me start with your second question, because I think I actually said the opposite of that.
Yeah,
Okay,
I think so too. That's what I heard.
Do you want me to clarify what I did say? Okay, right. So I actually, and I can follow up with you later, I meant the opposite of that. On your question of information, let me just be clear. What I mean is that I don't think information alone is sufficient to change behavior. I think we can all think of a million things we know we should do that we don't do. And in the programs with whom we work, we work in Head Start programs, and they have worked very hard telling parents the kinds of, and we do lots and lots of surveys with our parents, and we ask them lots and lots of questions along the lines of how important is it to read to your kid? Whose responsibility is it to promote children's math and learning? And maybe they're just telling us what they think we want to hear. That's certainly possible. But 90% of the parents tell us that they are their child's first teacher, that it's very important for them to be promoting their kids' learning in the home environment. This is a message that, at least in the Head Start centers, with whom we work, they have heard over and over again. This may absolutely not be true for something like an early childhood schedule of health behavior or vaccinations, et cetera. But at least for the kinds of, I think it's probably true for many different kinds of parent behaviors that many parents have heard messages about the importance of doing X, Y, or Z, and yet there's some kind of behavioral bottle, and they agree with those things and they aspire to do those things, but there's a bottleneck between knowing and doing. And we try to think of this as how can these approaches close the gap between aspirational parenting and actual parenting. And I just do not believe that telling people again something that they may already know is sufficient. That we need both things. We need the information maybe in some instances, but we need a mechanism for converting that information into action.
Ariel.
Hi,
I'm
Greg.
Greg Duncan from the University of California, Irvine. My office is just a few minutes away from here, so welcome everybody. Fascinating. I like the kind of conceptualization up front, but I wanted to ask if indeed the key is parent choices and behavior, as you said, what's the grand vision for approaches to effective interventions? I mean, you talked about one particular example, you're developing another. Is helping parents a matter of just developing this collection of behavioral kind of interventions, or is there, which has a very kind of ad hoc feeling to it, right? Or is there some broader vision of how the field should reorient itself toward the kind of view that you have of what needs to be done?
Yeah, that's a great question. I'd like to develop a grand vision, and I'd like to develop more of a vision than one by one, can I use these tools to manipulate some behavior, and in the end I have 5 studies and I've manipulated some behaviors. I don't want it to be, as I said, as lofty a vision as the one I think developmental psychology has brought to the table for so many years, which is, you know, as I said, changing all these things at once and kind of in this ill-defined way trying to make parents into different kinds of people. What I need to know to have a grand vision, which I do not yet know, is what are the 5 things that I would want parents to do that have a demonstrably causal impact on an outcome of demonstrable importance later in life. If I knew the answer to that question, I would develop a vision of this around it. I regret that I do not know the answer to that question because I don't think that our field has produced the answer to that question. We started with reading because mostly you can't argue with that. You could say talking to your infant. I mean, all the stuff about, you know, Dana Susskind's work and others. I think that's sort of talking versus not talking to your infant is a pretty, people can get behind that. Routines for little kids, probably super important. Health, you know, adherence to certain kinds of nutrition and health-related behaviors, probably super important. Not harsh or neglectful discipline strategies, probably super important. So I'm starting with those. That's my 5-year agenda, but I wish I could convince you that I know absolutely that those are the right ones. I can't, and I just think we don't have the evidence that, we have a lot of theory, but, so I'm trying to get there, but I'm starting with, you know, just the experiment. And I'm hoping that the experimentation obviously gives me more than just the treatment impact. I'm hoping that this work will help me build a theory as I go along.
Very interesting presentation and work. I'm Rick Barth from the University of Maryland School of Social Work, and I'm on the committee. In the old social learning literature, there's a concept called the behavior trap. And the behavior trap was that if a parent does the right things with their child, like catching them doing well, that eventually not only will the child improve, but it will eventually trap the parent into doing that more. So it's sort of an ironic term, but the basic notion is that you don't have to maintain these external reinforcers at a certain point, because the process will become internalized and the behavior will be effective enough to lead to continued use of the positive behavior, and so on. So, but I'm wondering whether in your little study, you saw a fair amount of change in the direction you didn't want to see in terms of continued reading to the point where it was a non-significant difference. And that's just one study on one topic, but I'm wondering what your general findings are with regard to the perseverance of better, if you will, more successful behavior by parents over time, or whether you think there's going to be a need for sort of constant behavioral structures and supports and boosters in order to keep more successful behavior going forward.
Yeah, great question. On the latter, how you just wrapped up, I think probably yes. I mean, our intervention was very light touch. It was very short. It was 6 weeks. We kind of picked that out of a hat, okay? Because again, I had no guidance on how long does it take to form a new habit, other than some book I saw on, Barnes and Noble that said 6 weeks to a new habit. So we chose 6 weeks. And, I think the fact that our treatment impact faded relatively little, at least in the short term, and I mean the magnitude of the difference, even after a 3-month gap with no interaction with the parents, was actually quite large. I can't make anything out of it because it was tiny samples and not statistically significant. But if you look at the absolute level, it was still pretty big. I think there's a lot of promise for sustaining these behavior changes. And again, it's possible that we can do it in so cheap a way that if it has to be sustained for a long time, then let's do it. I mean, eventually, everyone's going to be texting everybody to death. And, texting is not going to be a vehicle for behavior change, I predict, in like 2 years, because it's just going to be like everything else.
Let's just get one more question, and we've got just 3 minutes
sorry,
left.
okay.
No, it's okay. I just want to make sure that all the committee members get their questions in our 20 minutes. I'm sorry, and then we'll,
I have 3 minutes?
yes, there's 3 minutes left.
Second question, I'll give you 2 minutes to answer it. Great, thank you for coming. I really like this. It's so simple, elegant, and easy to do. And then I start worried that it's so simple, elegant, and easy to do. So I have a couple questions.
Can I have you just ask one question?
Oh, can I make it longer? I'll buy you a coffee tomorrow. Okay. Well, they're kind of related. The first thing is you have mothers. You don't have a study of parents per se. And I love it if it can be just acknowledged someplace. This is a study of mothers reading to the children. And we talk, you heard from other people, and I do a little work with dads. And, a lot of the dads are there. So I'm always wondering whether you will have this multiplicative effect if mom is reading to child and dad is reading to child. What would that look like? And maybe the effects will be stronger. And so reading is relatively an easy thing. Kids read at school, they read, so the effects of the other things that may have had a multiplicative effect on your intervention is not clear to me. But it's a little reductionist, and I think as a parent, you're right. I mean, what is parenting? I was just texting earlier my 20-year-old who has left himself out of the house. I mean, what is parenting, right? So these little things are not little things, a big thing, but I wonder as we get into this social stuff and emotional stuff, the child is a one big human being that has all this stuff in it, whether how are we going to conceptualize a little bit of a reductionist approach to parenting when, what, if I just lost my job, I'm not reading to you. I don't care how many text messages you send me.
Great. Thank you so much.
That, you see?
Okay. I mean, just briefly, we asked the families in the Head Start centers to identify the primary caregiver for the child. It won't surprise you that in these contexts, this is mostly mothers. We did not, deliberately exclude fathers. We did have a few fathers, not enough to look at separately. I don't see any reason that these approaches couldn't be used with fathers as well.
Great. Thank you.
Is that it? Okay.
We've got time for just one last question. We have one last question. Please, could I have you come to the mic, please? No, it's okay. Yeah.
Oh, okay, good. Okay, quickly. Hi, Ariel. How are you? I'm Portia Kennel from the Ounce Prevention Fund, and I'm here on behalf of the Campaign for Third Grade Reading. And I want to, I don't know if it's a question or an affirmation. I want to affirm your thinking about parenting from the perspective you're saying about you realize that we have the science. However, parents aren't just running around waiting for our great ideas to be done to them. And that what we don't know is we really don't know, and we're trying to figure out, and that's what you're trying to figure out in your work, is what really makes a difference in supporting parents, not just children, but supporting parents to be what they want to be and aspire to be for their children. So yay, I'm developmentalist too, and I realize that sometimes our developmental theories don't always work. We need to know more, the science about what is it that really will help parents be what they aspire to be for their children. The other thing I want to say, and it's just a comment, is just for the record, I am thinking a lot about poverty. I've worked in this field with parents and children from this population of families, Head Start, that you're talking about, for 31 years. And I am concerned about the alarming number of children and families that are falling into poverty. Now, I know that it's not the mission of this institute to deal with that, but I'm just saying that alarming numbers are falling into poverty. And as we're working on this intervention to figure this out, it may be also important for the Institute to recognize the powerful impact that poverty continues to have on families as it increases as I speak. So that's all I have.
Thank you so much. Let's thank Dr. Khalil for her presentation.
I want to thank everyone, the practitioners earlier this morning, and Dr. Khalil for that, and the moderators, my fellow committee members, for such a terrific morning. We're going to take a short break, and we will return at 10:30 to continue. And I also just want to say that in addition to being the committee chair, I also am a professor at the University of Pennsylvania. Just want to make sure that if anyone's listening, my affiliation is also well known.